Dialectical behavior therapy. Anybody do DBT work? Anybody? Our clinic is a dialectical behavior therapy clinic, and so we've all been intensively trained. I highly recommend DBT, and that's an unbiased perspective. When I first started doing DBT on my practicum during grad school, I had never heard of it before. My supervisor said, if you pay attention, you're going to use this stuff. And it's so true. This is stuff that I've used in my natural life every day because it's very skills-based, it's very practical. It was developed by Marshall Linehan in 1993 as a treatment for borderline personality disorder. And since then, it's been proven with substance use, with bulimia, with depression, with anxiety. It has 4 basic modules on mindfulness, which is really the art of staying present in the moment. So there is nothing anxiety-provoking about this room, unless you hate the color gray, and that's probably associated with something else. So if you were just fully present here right now, you probably wouldn't be anxious. But your anxiety level goes up when you start thinking about the argument you had with your spouse last night, and how you gotta pick up your kids, and what are you gonna make for dinner, and how you gotta do laundry, and you're so far behind, and I just stressed you all out, I know. But that's when we start to get anxious, right? Is when our minds wander. So if we're able to stay focused in the present moment, we really do reduce a lot of anxiety. Obviously easier said than done, right? But there's a lot of mindfulness skills that really help you to be able to do that, which are just tremendously beneficial. Emotion regulation. People with anorexia have what we call alexithymia, which is a fancy psychologist word for they don't have words for their emotions. So they're typically pretty disconnected. And so helping people to be able to label their emotions, helping them to be able to identify them in the moment. So it's really not that I'm mad, I'm hurt, right? Big difference in my response. So helping people to be able to adequately label them and then to deal with them in the moment is the essence of emotion regulation. Distress tolerance, if we look at emotions on a scale of 1 to 10, and 10 is like, I'm gonna jump out of the car, jump out of my skin, and screaming, I'm really upset. Distress tolerance is for when you're like a 7 to 10, right? Because when you're in that place, think about you, when you get really, really, really upset, it is not the time you want to sit down and journal and talk about your feelings, right? That is not going to be effective. You're not going to think about when you're mad at your spouse or your kids or whatever, and you're sitting there and you're arguing, you're not getting anywhere, right? That's not the time to resolve things. You got to take a time out. So we do things like change the temperature, hold ice. Let it melt in your hand. That's a great thing for your clients who get panic attacks, who have extreme anxiety. Let them melt an ice cube in their hand. And it activates a response called the dive response. It's a physiological nerve response that calms you down from the inside out. Have them put their face in ice water, right? Have you ever been crying so hard and you wash your face off with cold water and it helps? Amp that up a little bit. Have them put it in ice water. Have them put their head in the freezer. If they're driving, have them turn the air conditioner on full blast and put it on their face, right? These things help. Have them do 10 jumping jacks. Even for my exercise addicts, I explain intense exercise is not running 10 miles, it's doing 10 jumping jacks, right? You get the heart rate up, you change the blood flow from the brain, and it really does calm you down. So these are all things that you can do when you're in that I don't care kind of place, right? That are easy and they don't require a lot of processing or a lot of emotional energy. These are the types of things you're learning in distress tolerance. Interpersonal effectiveness, a lot of people, and particularly eating disorder patients, have a real hard time asking for what they need. They have a real hard time saying no. So I'll have people that are committed to doing stuff that they volunteered to do that they have no interest in. So, because they feel guilty, right? They feel bad. They feel like they have to. So a lot of interpersonal effectiveness is telling people how to say no. A good rule of thumb, if you haven't heard it before, we do Dear Man, which everything in DBT is an acronym, by the way. It's like being in the military. So the D is describe the situation. And it's just the facts, right? So it's something that no one could argue with. So if I'm going to Dear Man you, I would say, and say you were late to dinner, right? Then I wouldn't say, God, you're always late to dinner, right? Now we're starting a fight. Now we've used always, we've started out with you, and no, you've already shut down, your defenses are up. If I say, I called you yesterday and asked you to dinner at 7 p.m. You arrived at 7:45. Those are facts, right? Really hard to dispute. No one could get around that. No one could possibly see that differently unless your watch was different. But like, those are indisputable facts. So that's describe. Describe the situation. E is express your emotions. And that's where you can actually say, it really hurts my feelings when you're late. It makes me feel like you don't care, right? And again, we're doing this effectively instead of, you know, you horrible punk, why are you always late? You don't care, right? We're not doing that. So we're actually expressing our emotions. We're being a little bit vulnerable, and we're saying it hurts. It hurts my feelings when you're late. Ask is the A, excuse me, and we want to say it very specifically. If you're going to be late in the future, can you please let me know, right? Okay, now you know exactly what I want. Can you please let me know before the time that we're supposed to meet? Let's be clear. Don't text me at 7:15 and say you're going to be late, because duh, I just figured that out. So can you let me know beforehand that you're going to be late? Okay. R is reinforce. And that's where you say, and I will do the same for you, or it will cut down on problems with us. We won't have as many fights. It'll make me want to hang out with you more. I'll be more likely to make plans with you. Whatever it is, right? It's that give and take. You scratch my back, I scratch yours. This is what you get out of it. So that gives people a good structure to be able to have difficult conversations with. Just another little twist on that you may have heard is I see, I feel, I want, I will. And that corresponds, if you look, with the DEAR, with the describe. I see, this is what I see in the situation. This is how I feel about it. This is what I want from you. And this is what I will do in return. So this is great stuff to teach your patients to help them to be able to get some structure to have those difficult conversations. And it kind of gives them some confidence. And I actually had a friend that I went to grad school with who, I mean, doctoral psychologist, right? And she would take note cards into conversations because she didn't want to forget something. And I thought, you know what? She's learned how to be effective, right? Like, you don't have to just go in there. She said, I don't want to finish the conversation and think, man, there was something I didn't say. And so I'll tell my patients all the time, man, just write out your little dear man, you know, write out what you want to say, and it'll help you stay focused, and it'll give you something to center on, and you won't be so nervous. And it'll help you to actually say what you want to say and to be more effective. So that's one of the interpersonal effectiveness skills that we learn in DBT. So you see, it's very skills-based. It's very take-home stuff you can do today. We know when it comes to eating disorder prevention, the only thing that has ever showed any sort of promise is dissonance-based therapy. And Carolyn Becker, who's actually a professor at Trinity, has worked with Eric Stice, who used to be at UT Austin, and now he's up in Oregon, I believe. And they do a dissonance-based therapy, and they really look at dispelling the thin ideal. And this is for eating disorder prevention. I will say it also is a good technique to use for treatment. So because what we want to do is we know that there's a problem when people say and do something different, right? Not just for us on the outside getting annoyed with people, but internally there's a problem when we're saying and doing something different. We're going to change one or the other. And so that our behavior will correlate with our thoughts, okay? So for dissonance-based therapy, what we really want to do is if I'm living like, gosh, I want to look like, you know, I don't even know who the cool celebrities are these days. Just somebody, right? Like, I want to look like Jennifer Garner or whatever, right? Then I'm trying so hard to be like that. Then if I can come in and look at pictures of Jennifer Garner where she's not all touched up and I see that she looks normal, and I see that that's altered, then I'm creating dissonance, right? Because now all of a sudden, whoa, that's not what I thought. And so having people do that, having them write letters So when I'm looking at those magazines that are lowering my self-esteem and I'm comparing myself to that, I'm going, gosh, I want to be that. And then I turn around and I write a letter to the advertiser and say, you're showing unreal images. Please stop. You know, you're hurting girls. You're leading to eating disorders, all these sorts of things. Now I'm an advocate, which gives me some kind of purpose and I feel good about myself. And I've created dissonance, because how can I say that I respect this when I'm saying you need to change it? It's causing problems. Does that make sense? So dissonance-based approaches are great for depression, for eating disorders, for anything. If you can get people to start saying things differently than what they're doing, you start the wheels of tide to change.
So how would you do that? Like, okay, I don't know if you ever went like on Facebook and all the girls were doing that Kylie Kardashian challenge.
Mm-hmm.
Like sucking all the,
Yeah.
And then she came out, I think later on, and said like, I wasn't trying to encourage nobody, and I wouldn't, you know, ever tell anybody to do this or whatever. Like, so there was a dissonance because you did this, of course you did it the right way, and went and had, you know, surgery or whatever. Or, but yet you're saying like, no, I wouldn't encourage this.
Absolutely. So pointing out stuff like that, right? So anytime I see, you know, articles or anything of people that there was this great Target bikini ad. Y'all have to Google it, from like last year. And it was this girl, Target put out this ad and they retracted it pretty darn quickly. Because when they went to Photoshop this girl, whoever did it was like an intern on first day of the job or something, right? Like her waist was like this, and like this arm was like super square on one side, and then like half of like they were trying to get rid of, I guess, like the thigh gap, which I didn't even know what that was until a couple years ago. So they got rid of her, you know, the space in between your thighs. I guess it's like a thing. So they were trying to get rid of that, and they ended up making her like all boxy from down below. I mean, it's just the most ridiculous looking thing. So that stuff, I print that stuff up, and that's stuff that you can use with patients all the time, and just point out, look at what we're putting out here, you know? That creates dissonance. When it comes to depression, I'll often tell my patients, make a list of everything you do when you're depressed, right? I wear my pajamas, I don't get dressed, I don't shower, I don't talk to people, I listen to sad music, I stay in my room, I stay under a blanket, right? All these things. Don't do any of that, right? You're not allowed to do that anymore. If you act like a depressed person, you're gonna be depressed. So then make a list of stuff that non-depressed people do and start doing that stuff, right? And so you're creating those differences in how they think and how they feel. And it works.